Welcome to Duke Spine Institute live stream. It's our first surgery of the day. Our patient comes from Florida. He's had back pain for 24 years. Now, his back pain has been increasingly worse over the years to the point he can't take it. He came to Duke Spine, but he had already had back surgery. You can actually see a scar on his back, right, where he had a laminectomy, discectomy done. So unfortunately, he didn't know about us before he had that done. Now he does. We're going to help this guy out, but he's got a lot of scar tissue from his prior surgery. Now, what causes back pain? There's about 30 different things that cause back pain. A little bit of numbing medicine. And in his case, he's got 1, 2, 3, 4, 5, 6, 7, 8. 8 different causes, including 2 discs, 4 facets, an SI, and a piriformis. So we're going to start by fixing his 2 discs with our Duke laser disc repair. Afterwards, we're going to shift to the facets, and then the SI, and then the piriformis. I need to be a little bit higher. All right, if you have questions, feel free to ask me. I'll be happy to answer them. In the meantime, let's show the audience the 30 different things that cause back pain that are common. I'm Dr. R. Deukmejian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. From our video, you can see that there are many causes of lower back pain, and this is why it's confusing for doctors and patients alike, because doctors don't know the causes. Duke Spine is the one who figured them out. I figured them out with my team here, and now we have a nice video showing the world what are the causes of back pain. But the problem is 99% of doctors have no clue that these are the causes of back pain. Therefore, they don't know how to look for them or fix them. But we not only figured out what causes back pain, we also figured out how to cure it. And that's what we're going to be doing. So this patient has back pain coming from 2 discs and then 4 facet joints and the SI joint, which is on the right, and the piriformis muscle, which is torn, and we're going to fix that later. Any questions?
At this moment, no current questions.
All right, so normally we're going to test the disc to see how painful it is, but our guy is sleeping. He is snoozing. Shot? Shot? All right. Oh, yeah, he's coming off the table. Look at that. See that? I didn't even tell him I was injecting, and he's up. Okay, you guys saw that. That's clearly a painful disc. And there's the next one. Painful as well. He wants to come off the table. So I couldn't get a pain score, but his blood pressure went up. Heart rate went up. He's bleeding a little bit because of it. All right. From his skin. No big deal. But the point is, you could, even though we didn't get a number out of him, he responded clearly. All right, let's just go ahead and put him back to sleep so he can comfortably enjoy the surgery. In the meantime, let's show everybody, why do these discs cause so much pain?
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Yeah. All right, welcome back. You can see from our video that there's a traumatic injury to the disc, usually a motor vehicle accident. or a slip and fall or a sports injury, which then causes a tear in the back of the disc. That tear then results in, did you get it? Hold on, no, it won't work.
You just is moving the, yeah. Let me see if I, you got it.
Shot. That tear then results in a herniation over time as people bend and twist and lift. The herniation then pushes out into the tear, and what you get is inflammation developing from that herniation in the tear as the body is trying to heal. The inflammation, of course, is then going to cause pain over time, because what happens is inflammation, chronic inflammation, then causes nerve fibers to become sensitized to pain, and then that causes chronic pain. So the pathophysiology of back pain is now understood, but only understood at Duke Spine Institute. Unfortunately, other doctors still don't understand it. So you're not going to get answers elsewhere. You're not going to get help elsewhere. The medical community is led astray. They're still in the ice age of understanding, or you can call it the dark ages. And Duke Spine Institute is leading the world in the diagnosis and curing of back pain and neck pain. Yesterday, or 2 days ago, we had a thoracic Duke laser disc repair from Georgia. The patient went home with zero pain. His pain is completely gone. He's had it for years. He was going to give up on life. He was considering suicide because he couldn't find any relief of his thoracic back pain. And then he, like a miracle, he was way up at night. On YouTube, he said, and you're going to see his testimonial. Henry's working on it, releasing it. But he said he was up at night looking through the YouTube channel, and he typed in, you know, back surgery, and came across our video, Duke Spine Institute's videos. And he said he contacted us after filling out the MRI form. We did a Zoom call and made a diagnosis, and then recommended his treatment, which was laser surgery, the same thing you're watching right now. He's cured. His pain was cured as soon as he woke up because we treated the source of the back pain, which is the tear in the disc. That tear, being the source of back pain, was discovered by me, the founder of Duke Spine Institute, many years ago, about 19 years ago, and I published our treatment for that tear, how to cure the pain. Everything okay, Sam? All right. Any questions from our audience?
At this moment, no current questions.
All right, good. So what you're seeing, folks, is I'm using the laser to clean the tear that's in the disc. And the tear has a bunch of junk in it. How is the irrigation? Yeah, looks okay, but it doesn't seem to be floating all the pieces out. There's a big piece of herniation right there. Seems a bit weak. Seems a bit weak.
I can pop it up.
Yeah, why would it not be a maximal anyway? You guys not run it maximal?
But not the pressure maximum, no.
Why not?
Because it's too much for the small bag.
Like, what do you mean too much? It'll pop the bag?
Yeah.
We don't want to pop the bag. Do not pop the bag.
Is that better?
Yeah, probably. It's hard for me to say just yet, but any questions, Henry?
At this moment, no current questions.
Okay, so the laser fiber there is 1 millimeter wide. You guys are fine. The irrigation's fine. Just leave it alone. And these are all pieces of herniation, the white stuff you're seeing that I'm zapping away. Every one of these little things is a piece of herniation stuck in the tear, causing inflammation. Why don't we run a testimonial then, since we don't have any questions?
Not a problem, of course.
I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. I have a patient with me who just had the Duke laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year, I'd say close to 5 or 6 months. It's one day after and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Duke Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
You had, was it back and leg pain, correct?
back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
So
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct,
Coral
correct.
Network.
Coral Network,
What
yep.
do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Duke Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So, thank you.
You're welcome, my friend.
Appreciate it.
Congratulations.
Take
Take care.
You too.
Okay, welcome back. What a great testimonial from one of our patients who had the laser surgery done. We have literally hundreds upon hundreds upon hundreds of testimonials. Check out our website and our YouTube channel. You will see literally hundreds of testimonials, probably 400, far more than any other doctor or any other clinic in the world. And they're all cured. Their pain is literally cured. So who else can do that? Nobody. What kind of questions do we have, Henry?
Got a couple of questions. This first one is coming from Mark on YouTube,
Sure, I'll take it.
asking, does laser surgery get rid of calcified material from discs that has torn?
Yes. Yes, laser surgery gets rid of whatever we need to get rid of to cure back pain and leg symptoms. Leg symptoms include leg pain, leg weakness, leg numbness, and tingling. That comes from a pinched nerve or irritated nerve at the back of the disc where the herniation is, and we're able to treat that as well. Unfortunately, a lot of people don't understand what's necessary to fix, so they ask questions like the one that was just asked, which is, does laser get rid of bone spurs? The fact is, bone spurs never cause symptoms, ever. Maybe 1 in 100 patients with bone spurs will have some symptoms. What causes symptoms is inflammation in the tear. And the surgery you're watching is the best surgery in the world, the only surgery in the world that fixes that. So now, do other people do laser surgery? No, they don't do what we do. They may say they do it, but they don't. Duke Spine Institute pioneered this technology, and we are the only ones doing it. If you want to see somebody else is doing it, ask them to show you the surgery. that they're doing, so you can watch it and verify that they're doing laser surgery the same way I'm doing it. But if you don't do the surgery the same way I do it, you're not going to get the same results. You're not going to get a cure of pain. Has to be done my way, which I've not trained anybody directly to do this. So anybody out there saying they do laser surgery, they're doing something else. I wouldn't trust it. Not for yourself or people you care about. You have to come to Duke Spine to get the best.
We have another question.
All right, we're almost done with this disc at L45. We're going to move to the L5S1 next. I'll take the question in a moment, but I want to show you there's a lot of little pieces of scarred herniation, like that one that was just floating there. Okay. This is not a normal looking disc. This disc is very abnormal. It's been damaged many, many years ago, over 20 years ago, and this is what it looks like when a disc has been damaged so long ago. Lots of white scar tissue and calcification of the disc and ligaments. How are we doing there? All right, we'll take any other questions you might have.
Yes, we got a couple more questions. Next one is coming from Jacobo45 on YouTube.
Jacobo45, welcome to our stream.
Saying, hi, doctor.
Hi there.
Doesn't the remaining 30% to 50% of the herniation left after surgery hinder the healing of the annulus fibrosus?
That's a great question. Doesn't the remaining 30 to 50% that we don't get of the herniation hinder the healing of the annulus fibrosus? I would imagine it does, but I don't have any proof of that. All I know is that people's pain goes away and stays away for their lifetime. So it works. Sometimes we don't always understand why everything in life works. We just observe that it works. We repeat what we do. We get the same results that it works to get rid of pain. And that's it. You move on and you try to understand it as much as you can. But there's a lot of things about the human body we don't understand. One that we do understand is that when you're having back pain and it's coming from a disc injury, that it doesn't go away on its own. That it needs this surgery to fix it. Okay, I think I'm done here. There's still a few more small pieces that I can grab. But you're right. No surgery in the world gets rid of all the herniation. It's not possible. Doesn't matter what technique you use, or open or closed, minimally invasive, you cannot get rid of all the herniation. It's impossible. So the people that we've treated, who we've cured, they still have some herniations there. And yes, I'm sure it affects the healing, but they do great. So that's all that matters, right? They have a normal life. They go back to doing all the activities they like, and their work, their exercise, and they have no more pain the rest of their life. That pain is gone. It's cured. So all I know is, as a scientist, sometimes you can't explain everything you see, but science begins with observation. What you're observing is the world around you. You're observing either a situation that exists in nature, or you're observing an effect of an interaction with that natural phenomenon. In this case, we have disc injury, which I've been treating like this endoscopic for 19 years. And I used the laser 19 years ago. And I observed the results, which were that the patient's back pain went away and stayed away for the rest of their life. So all I know is that it works. I don't understand all of it. I do understand most of it. I understand more than anybody else in the world today, but I don't understand 100%. Point is, it works and the disc heals, and people go on having a normal life. The disc never looks normal. Again, on an MRI scan, all these discs that I repair are abnormal looking. There is no way to make a disc look normal, even with surgery. There's no surgery or treatment in the world that makes a disc look normal, unfortunately. Once a disc is damaged, it will always remain abnormal looking. The best we can do is to give you a functional result, which is take away your symptoms so that you can have a normal life. That's really it. I never tell people we make the disc look normal, because that would be a lie if I did. I can't make the disc look normal. And as Dr. Berndes pointed out, we don't do cosmetic spine surgery. Cosmetic disc surgery, that's even better. All right, we're done here. We're basically outside the disc right here now in the foramen. You can see a little bit of fat around the nerve root, but that's where the herniation was. And we've pretty much gotten rid of it. There's still a tear there, which will seal up over time. But his disc pain should be gone. Now, he had a lot of disc pain. When I injected that disc, he was still sleeping. He literally almost came off the table because it hurt so bad. If that disc was not hurting him normally, he would not even feel it. So the fact that he responded to the injection of the dye into the disc tells me that is a painful disc. Yeah, this must be bent. Can we replace it maybe? All right, folks, keep the questions coming. Happy to answer them for you. We're finished with one disc. We're going to move on to disc number 2, which is the L5-S1.
This next question is coming from Rusty on Facebook.
Hi, Rusty. I hope you're not.
Asking, how long does it take for the soreness to go away after laser surgery?
Great question, Rusty. So here's your numbers. After this surgery on the back, the pain from the procedure is usually gone in 50% of the patients this evening. It's gone this evening. 50%. By tomorrow morning, 90%. Tomorrow morning, 90% of the patients will say the pain is completely gone. 90%. And then 10% of our patients that have surgery like this, they take about a week for the soreness to go away, or sometimes a little bit longer. But basically, it goes away overnight. That's really the truth, is that it goes away overnight. Now, the other thing you should understand about the surgery, which is very important, I talk about it, is these patients don't get any post-operative painkillers. They don't get narcotics. We don't do narcotics because it's not necessary. We're not hurting their body. You see, normally spine surgery, the surgery is so damaging and destructive that the patient will literally have horrible pain after surgery for weeks because the surgeon chopped up the inside of their body with that laminectomy, okay? Or a discectomy or whatever procedure the surgeon is doing. They're destroying the patient's body internally. Hold on. Yeah. Okay. So with the laser surgery, since we're not damaging anything internally, there's no destruction or damage of tissues, no scar tissue, no inflammation, no pain. That's why the pain goes away overnight. And there's no need for narcotics because we're not doing any damage to their body, so they're not hurting afterwards. But other types of spine surgery, you have to take powerful painkillers for weeks and months because all the damage the surgeon did during the surgery. And if you look at an MRI 6 months later, after invasive spine surgery, you're going to see scar tissue and dead muscle. And that's because they damaged the muscle so badly during the surgery, but it's under the skin so you can't see it. But your muscles die and they turn into scar tissue, white stuff. And if you look at an MRI after invasive surgery, you're going to see all this white stuff where the muscle used to be because the muscle's dead. Now, he had a laminectomy done himself, and he has some dead muscle. I can't make the muscle come back. Nobody can, but it doesn't matter. In the end, that just explains why it hurts so bad during open back surgery like laminectomy and discectomies and fusions, is because there's so much damage being done by the surgeon. So the recovery for this surgery is overnight, and people's pain is gone by the next day, 90% of the time. People's surgical pain is gone. Now, the only thing our patients take at night is Tylenol and muscle relaxer called Robaxin. So we give patients Tylenol and Robaxin. That's all we give them, is a prescription for Robaxin, because Tylenol is over the counter. But if the pain is really bad for some reason, you just take an Advil or ibuprofen. All that stuff's over the counter. You don't need a prescription for it, because it's very gentle and safe medications and non-addicting. So yeah, that's one of the things to keep in mind with the surgery, is the fast recovery and no need for narcotics. Great question.
We have a comment and a good amount of questions. This comment is coming from Mark once more on YouTube.
Yep.
Saying, unfortunately, I live in Australia, so it would be hard to see you about my back pain and numbness.
Well, Mark, we offer a free MRI review. You can do it from Australia. We've had many people from Australia do the MRI review to get a diagnosis. And what I'm saying to you, Mark, is you don't know why you have back pain. I can almost guarantee you whatever you think your reason is not the right reason. And the only reason I say that, not knowing you at all, is that a lot of people think they know why they have back pain because they look at their MRI and they see a problem with the disc and they think that's the cause. And you're probably right, that would be a cause, but that may not be the only cause. That's the biggest problem that we see, is that the average patient with chronic back pain has 4 causes. 4. So it could be 4 discs, but not likely. It usually is 2 discs and 2 facet joints, or 2 discs, a facet and a piriformis, some combination of pain. The point is, I can make that diagnosis for you and give you the answer as to why you're having your pain. That's very valuable to people. And if you don't understand that, it's understandable, because most people don't understand the value of a true diagnosis. They all assume the doctors make the right diagnosis all the time, but we don't. Most doctors have no clue how to diagnose back pain. So you don't want to go around through life hearing from your doctor that you have an uncurable situation when it's actually curable. So it's very important that you get the right diagnosis. And I'm happy to do your free MRI review for you if you submit the form and your images. And then you can get a 10-minute consultation from Australia without even leaving your house. That's what we offer people for free around the world. Doesn't matter who you are, where you live. The fact you're never going to come here, that's okay. We just want to help you understand what's causing your pain. Okay? That's kind of our charity thing that we do, to help people.
We have a couple more questions. Next one is coming from Winnie on Facebook.
Winnie?
Winnie.
Hi, Winnie. Winning or Winnie?
Winnie, like the bear.
Like Winnie the Pooh?
Exactly.
All right, I like it.
Asking, are you able to remove rods and screws from thoracic spine T4 through 8 by laser?
Yes. Yes, I am. A lot of people don't know that about Dr. Duke and Duke Spine, is that we have been doing fusions for 28 years. So before we were doing laser surgery, we were doing lots of fusions in the neck and the back. And I've even published papers on fusions, how to do it properly and get great results. You can find my papers online if you go to PubMed in the United States National Library of Medicine. Lots of fusion papers you'll see under Duke Majan. But yes, we can take your hardware out, not a problem. What I need to know is who manufactured that hardware? What system did they implant? Okay, it's kind of like a car. If you want to get a part for a car, you got to know the make and model and year, and then you can find the right part. When we take hardware out of the spine, excuse me, we need to know the make and model of that hardware, okay? So you'll have a manufacturer and you'll have a model. And once we know that, we can get the right equipment to take it out. And that's pretty easy to take out. I wouldn't say easy, but it's obviously easier to take out when you have the right instruments. But yeah, we can do that. Not a problem. All right, you can see the herniation at the base there. That thing was stuck in the tear. It's blue. It's rolling itself right on out of the tear. It's huge. Big old herniation. I have 5 minutes on this disc. 5 minutes. You guys see it?
Yes, we do.
Huh? Yeah, I understand. So we're almost done. And then we can get the other stuff done. Whatever you need to do for his safety.
We have a couple more questions.
Take them.
Next one is coming from Pawn Lust on YouTube,
Uh-huh.
asking, how is the thoracic patient? Also, are there any discs you wouldn't consider in the thoracic? I just tuned in.
Hello, Hanlos. The thoracic patient from Georgia is 100% of his pain is gone. He already left to go back to Georgia. He has a testimonial Henry is about to release, and he was so happy that his pain is gone. We have another thoracic patient. It's the last surgery today. She's from Miami, and we're doing 2 discs on her.
This next question is coming from Faisal on Facebook,
Hi, Faisal. Welcome.
asking, Doctor, if you have disc pain in the cervical spine, can the pain radiate resulting in headaches and mid-back pain? Thank you.
Yes, cervical spine herniations definitely cause headaches. It's called a cervicogenic headache. Very common problem. When we treat those patients with laser, it takes that pain away. I've got 2 minutes left on this disc. What do you want to do? Try the facets?
I made some adjustments, yeah. We've been asleep for hour and 5.
All right. Well, if there's any issue, you tell me and we'll stop. We can always bring them back. We can always bring them back for some more surgery, okay? All right. You just let me know. All right, folks. Any other questions?
Yes, this next one coming from Jacobo45 once more on YouTube.
All right, Jacobo. This is all herniation here. The laser's zapping away, breaking it down. You can see right here, the stuff is basically causing his symptoms. Go ahead.
Jacobo45 asking, when will the film spine scams be available to the public? We are waiting impatiently.
Ha ha ha. I love it. That's a great question. Henry, text Jeff and ask him. You have his phone number, right?
Yes, I do.
See, we have a lot of people asking, when is this film going to be available? Any updates?
Yes, sir. I will
So
do that.
we'll send a text to our director and producer. He's in San Diego. He may not even be awake right now, but let's ask him. Tell him that teeth are gnashing.
Teeth are gnashing, yeah. I'll put that in for sure.
30 seconds.
And then lastly, we have a comment coming from Mark once more on YouTube saying, thank you for your explanation. Very informative. I appreciate it.
Guys, you're welcome. We're just about done at 5-1. Our patient is big, really big guy. 6 foot what? 6'3", big guy. Big guy. And sometimes big guys get tired laying on their belly, okay? So we're trying to move quickly with a purpose. because we don't want him to get so tired he stops breathing. That's one thing our anesthesiologist is monitoring constantly. But I'm talking to him now, our anesthesiologist, and we're just making sure we can keep going, which we can. We're done here. We're going to move on to the facet joints next, so we'll bring you guys back shortly. Look for the next stream, it's coming.